Hello, friends, and welcome to Weekly Witness, Texas Impact's weekly podcast designed to help mainstream Texans of faith understand the legislative process and to help you engage with public policy in the great state of Texas. My name is Scott Atnip, your host and Texas Impact's Director of Public Witness, and this week we turn our attention from Austin to the nation's capital because the center of the policy universe is the government shutdown, and the decisions they make in the coming weeks will impact every one of us. Y'all, there are so many things we could talk about coming out of Washington right now, but the healthcare debate that's headlining the shutdown conversations impacts everybody, the entire healthcare system. So joining us for the conversation this week is friend of the program, Minister Christian Watkins, a Texas transplant currently serving in D.C. as the government relations advocate with Network Lobby. Christian has been in the middle of these conversations, providing trainings for faith-based advocates. And just before we recorded today, he was part of a rally that included faith leaders and members of Congress calling for Congress to protect our healthcare. Spoiler, we need more faith leaders and elected officials doing exactly that across the country, and we're going to talk about that today. So Christian joins us still in his clergy collar from the rally to give us a Shutdown 101, talk to us about the stakes related to healthcare, and give us some advocacy marching orders. I hope you enjoyed this week's conversation with Minister Christian Watkins. Joining us for the conversation this week is Reverend Christian Watkins, friend of Texas Impact and government relations advocate with Network Lobby. Christian, thank you so much for joining us.
It is a pleasure to be with you again. Yes, indeed.
You know, here's the deal, Christian. I always love hanging out with you. And most times when we hang out or talk, I feel like I might be the coolest person you talk to all day. That's probably not true today because you just came from an event where you had 15-ish members of Congress, a lot of faith leaders from throughout the country who care about healthcare, including Leader Jeffries. So I feel like I'm probably not top of the list today. Huh?
Yeah, anytime I get a chance to hang out with my friends in the faith advocacy community here in D.C., it's a good day, especially when we get to mix in like Leader Jeffries and Rosa DeLauro and Congressman Cleaver and the like. So it was a really good day.
Two United Methodists here, so always good to give a shout out to Congressman Cleaver while we have the conversation. So talk to us about that event. What was it? Why was it important? How'd you feel coming out of it?
Well, I mean, we're in the midst of a shutdown, and the shutdown is basically over because the Democrats want to stand up for millions of Americans who are about to see or have already seen their healthcare premiums spike because the tax incentives, tax
rebates,
the tax credits are about to expire, right? And so a lot of folks are seeing their premiums rise, and Democrats said, "Hey, that's a non-starter for us because we're fighting for the people." And we see that Speaker Johnson has once again another week of allowing Republican members in the House be on vacation and do in-district work. So they're not willing to negotiate in good faith. They're not willing to be at the table to renegotiate what was broken at the beginning of the year. Because you remember at the beginning of the year with the CR and that started the government shutdown. You know, the rescissions, the taking money that's already been appropriated for different programs across the country and reallocating it to ICE and to law enforcement officials, that has been ongoing. And so with the one big bad bill that was passed, they basically ended the tax rebates or the tax credits for healthcare. Republican or Democrats in the House and in the Senate have basically put their foot down, have drawn a line in the sand and said, "Hey, no further. We've got to restore these for all of our citizens, for we the people." So I'm glad. It's bittersweet that we're having this shutdown, but at the same time, I'm glad that the Democrats are holding the line for the American people.
Yeah, I want to come back to healthcare in a few minutes, but just for people who aren't as in the weeds as many of us and probably many of the people that you're hanging out with in DC today, talk to us about why the government is shut down. Like, talk to us about the budgeting process and how we got here.
So every year or every couple of years, Congress has to pass bills in order to fund the government, to make sure that normal processes and agencies are well funded in order to complete their work. And so this is that time. This is the time where Congress has to negotiate funding the military, funding veteran affairs, funding the different agencies that we the people rely on. And so as that process is continuing, because Congress is broken, right? We can go ahead and admit that. There are hiccups in the process. There's negotiations that aren't happening in good faith. So right now, because of that, they deem it necessary to pass a continuing resolution to fund the government at previously appropriated levels. So that's what's on the line right now, and that's why the Republicans say, "Hey, we've done our job. We've agreed to fund the government at previous levels." Now, those previous levels from FY 24-25 were inadequate to begin with, but that's what we're left with. And so with that, there was no provision in order to restore what was taken during the One Big Bad Bill, when the One Big Bad Bill became law, as well as in the continuing resolution at the beginning of the year that pretty much defunded essential government programs. So right now, that's why there's gridlock in Congress. That's why the Democrats are standing up. That's why the Republicans are standing down in order to the Republicans are perpetuating President Trump's agenda to essentially defund the government so that it can be remade into what and when I say they, I mean the architects of Project 2025, I mean the ultra conservatives that are hamstringing government functions in order to, remake it into their own image.
And so just to make sure I understand it, and I'm sure our listeners are all perfectly aware of all of this process, but the Republicans control the presidency, the House, the Senate, and were able to pass the one big, as you're calling it, one big bad bill, with only 50 votes in the Senate because it went through reconciliation. Is that right? And so this is the first chance for the Democrats to be able to have some kind of leverage over the situation because it requires 60 votes to pass this budget. Is that right?
That's correct. That is correct. This is one of the first times that Democrats have actually been able to exercise power and not be steamrolled by the majority party, which is the Republican Party now.
All right, so let me ask this. I can think of, like, you and I could sit down and come up with 1,000 things that Democrats could probably choose to fight in this budget. But the thing that they have honed in on are the Affordable Care Act subsidies, those tax credits that you've been talking about.
Right.
Why do you think that's the one issue that they've really chosen to fight for in this budget?
Well, because they've heard from their constituents, they've heard from the American people, the people that are in their orbit, their staffers, even that, hey, my premium is about to go up. I've even seen it here in Washington, D.C., and I have a relatively stable job because I work for a nonprofit. But at the same time, our insurance premiums have gone up, and our organization has decided to make some financial decisions in order to make sure that the organization stays stable as well as we keep our health care. So everybody's feeling a pinch. But here's the thing. We're not in rural America. Some of your listeners may be. They're seeing hospitals shut down because they don't have that Medicare funding coming in like they used to. We've seen services being cut in other areas because of the rescissions and the defunding of government agencies that usually fund local and state initiatives, such as healthcare for people. And it's done and the Republicans are doing it under the false pretense that Democrats want to give free health care to illegal immigrants. No, that's not the case. That is not the case at all, because it's illegal to give undocumented immigrants health care, right? But what we have seen is that hospitals did have the choice of helping everybody, regardless of their healthcare status. That's one of the misnomers that people are hung up on because of the fact that, they have long lines in the hospitals. All the talking points that are being thrown out in opposition to affordable health care, which was accomplished under the Obama administration. And since then, it's been continuously attacked and rolled back. This is the line in the sand that the Democrats have drawn. No further can you go. No further can you go in defunding healthcare here in America. We've already gone too far. People are getting sicker. People don't have access to the care that they need, and the Democrats realize that. So that's why we are where we are in this shutdown.
Help us understand what the impact will be if I know one of the things you keep hearing is that Speaker Johnson and others have said we should pass the clean CR now, extend things for 7 or 8 weeks or whatever it is. If they were to pass that CR without addressing the healthcare subsidies, what would the impact be? What would the timing be on those increases in costs?
So with the passage of the One Big Bad Bill, it purposely wrote it into law that the effects would be staggered. The effects would be seen in a staggered time frame. A lot of we were beginning to see, or we are beginning to see, the effects of that bill moving into the latter part of this year. We're in the fourth quarter of 2025, and so if we continue down the same track without restoring those healthcare premiums, those ACA premiums, people begin seeing, the prices rise. But the majority of the impacts would not be seen until the 2025 or 2026 midterms, and that was intentional because they wanted to make sure that people were kind of uncomfortable. But then after the elections, and depending on who won the elections, then blame could be placed otherwise. I know that seems about as clear as mud.
Yeah, but that's the Medicaid cuts that go into effect after 2026. Is that right?
Yep. And here's the thing. Without those ACA premium tax credits, the cost of affordable health care, of the Affordable Care Act healthcare coverage would spike for 22 million people. Data shows that 4.5 million people will be immediately losing coverage because they can't afford it. And then it would go on from there. Average premiums are expected to increase by 20%. People are already receiving the notices, and they'll continue seeing those notices if the Democrats did not stand up. But go ahead.
So, Christian, I recognize we're recording this on Thursday afternoon, October 9th. We're going to post it on Friday. So things might change in the next, things could be changing now. I've got my social media up to see if there's any break news I need to talk to you about, but it doesn't seem like anybody's budging right now. What's the current reality in DC, and what should people be communicating with their members of Congress?
Basically, what's happening here in DC is it's quiet. It's eerily quiet. One, because Republican members have gone home. They're in district. Democrats, most of them, actually left today. Today's a wheels up day for members to go back to their respective districts. Staffers have been negotiating, have been doing the work of trying to get members and other staffers from other offices to coalesce around the idea that, hey, we've got to do something because the shutdown needs to end, right? But when both sides are dug in, and we're at an impasse, and we don't know what will break the impasse, break the silence, break the line between the two parties, right? But what I do know is that, I know y'all probably heard this line many times, and I hope for those who are hearing it for the first time, take it to heart. The power of the people is greater than the people in power. When we stand up, when we the people own our participation in the civic process, it's not just voting and one and done type thing. It's something that we've got to stay engaged and informed about in order to hold our elected officials accountable, right? Because we voted them in, we're paying their salary through our taxes. So we've got to make sure that they're doing the job that is good for us. So when more people do that and really show the members that, yeah, I can't just operate because of my funders. I've got to operate for the people that are holding me accountable, or I'm not going to get voted back in again. Then things will change. When more people get actively engaged, informed and engaged and listening to credible sources like Texas Impact's Weekly Witness, as well as all the other information that y'all put out there. Tag. Shameless plug.
Cut that. Yeah.
When more people get engaged and informed and involved in the process of politics, because politics is politicking all of our lives. We cannot, in this day and age, in the year of our Lord 2025, we can no longer say that we are divorced from politics because it's not my thing or it doesn't affect me. No, politics will govern your life if you don't participate actively in it. Yeah. And that's what'll change the tide.
Yeah. So I'm just seeing online that it looks like the House probably isn't coming back next week either. So that does mean Congress, members of Congress will probably be in your communities, friends. What do you hope people will be doing? I mean, what's the message? What are the actions? What does it look like to be engaged in a meaningful way right now?
One, go and find trusted resources, not just from Texas Impact, but also national organizations like Network Lobby for Catholic Social Justice, the organization I work for, or the National Council of Churches, or the National Council of Jewish Women, or the Reformed, or the Religious Action Center for Reformed Judaism, or the UUSJ, or the UCC's public, wherever. If you're a person of faith, you probably 99% of the chance you have a faith office based here in DC that is actually putting out talking points, putting out explainers that is unique to each expression of faith. And if you have no faith, or if you have little faith, go and check out the resources anyway. Find that credible information, get knowledgeable. You don't have to be an expert. You just have to know what the facts are and how it impacts you. And then go to your member's office, in-district office, request a meeting. You can be there all day. Pick a day, right? Or email them, call them, say, hey, look, I need to talk to somebody. And make your voice known that this has got to be, especially if you live in a Republican area. If you live in an area where you have a Republican member, pressure needs to be applied nonviolently in order to turn the tide of this shutdown. Because once members catch the heat from their constituents nonviolently, as members gain, because they have to record all the correspondence that comes through our office, whether phone calls or emails or text messages or letters, as they record it. And the information builds up and the correspondence builds up, saying, hey, look, we can't sit on the sidelines anymore. We can't allow this to happen anymore. When they know that their jobs are on the line, then they'll move. That's my hope. That's my prayer. Right. And I hope that people are getting their friends in the game. Right. Y'all organize at the church level. Pick a Sunday after church and be like, hey, we're going to write postcards to our member, and we're going to have a couple of our members in our congregation to drop them off one day. The staffers have to record each one of those for congressional record, right? And Scott, you know what I would love to see?
What's that?
If there were nursing homes and convalescent facilities that turned their game rooms into call centers and making phone calls to the different offices. If that happened across Texas, imagine the change that could happen. Because our elders are on the line, right? Our elders' care is on the line. If we don't have those tax cuts and those subsidies in place, their convalescence homes are going to dry up. And where are our elders going to go then? Are they going to go back home? Well, the ones that are working, the children that are working, the family that are working, they'll have to make decisions. Hey, do I stay home and take care of grandma, or do I go out to do my job? And can we afford a healthcare provider to come to the house? Yeah, we don't want to get to that place, but it's already happening.
Yeah. I loved all of that answer. The part I loved the most was the shout out for all of our interfaith partners and religious advocates who are doing the work in DC. There are so many good resources coming out from Network and others. And I do think that idea of bringing that information to our local congregations, to our friends groups, and making sure that people in our community are paying attention and have the resources to do this work with us is a really important piece of advice. And so my hope is that everybody who's listening today will figure out who in your religious tradition is putting out good resources in DC and use those to connect in your local community. If you need help with us, feel free to reach out. We'll be happy to help with that process. Christian, I know you are in DC, and I know we are, about 9-10 days into this government shutdown. Healthcare has been the focus, but I also want us to remember that there are a lot of people who are currently out of work, who aren't getting paid, programs that at some point will start running out of funds. As this shutdown drags on, what are you most concerned about?
I'm most concerned about those people that are on the line right now that may not get their back pay. I'm most concerned about those persons who have dedicated years to public service in their agencies and are treated like trash now. What is this going to do to our national morale or morale, right? What is this doing to the sense of community? I mean, during COVID, we figured out that we are no lonely islands. We need each other to take care of each other, right? We need each other in order to exist. Even though we were shut up in our own homes and whatnot, we still had to rely on other folks to wear their masks and do what they need to do in order to not spread the disease, the virus. For some reason, we've lost that. Hyper individualism as well as capitalism are running rampant all over us, and we've withdrawn into our different silos. Right. This is a chance for us also to realize that we need each other, and we've got to. This is an all hands on deck moment to turn the tide in politics and in society here in the United States, because we're marching towards a cliff. We're if we're not teetering on the edge of some unknown place that we should not be constitutionally. So it's up to each and every one of us to make the decision to say enough is enough and to get in the game.
So what do you think the end game looks like? Again, we're recording this on November, on October 9th. And it doesn't feel like there's an end near. What do you think? What do you think comes next?
That's a loaded question.
I know. I give you a hard one.
my tea leaves aren't tea leaving, so I can't give a specific answer to that. But I will say we have a choice of two directions. One, everybody realizing that they have skin in the game, or most people across the country realizing they have skin in the game, because we don't need everybody. We just need a critical mass to show the current leaders that we mean business and that they work for us, not the other way around. To put an end or to change direction as to where we're going, or the alternative to where the Constitution doesn't matter, to where President Trump can run for a third term. Let's say that, where millions of Americans lose their health care and benefits and whatnot. Jobs will not be coming back to the United States. Our fields will shrivel up and die. It's between the dark and the light, and I'm going to choose light every time.
You've mentioned your advocacy partners in DC. You gave them a shout out. I've given them a shout out. They doing the work right now? You feeling good about what's happening in the interfaith space in DC?
Oh, yeah. I mean, today was a good example of it. The partnerships that have been developed since the 50s. The Washington Interfaith Staff Community is the coalition of those interfaith partners, the ones that I mentioned before, plus many others. We've been in existence since Martin Luther King marched on Washington, and have been growing and working together and have been influencing policy and have been working with members in order to bring about the Affordable Care Act and the infrastructure bill that Biden passed and many other robust pieces of legislation that have positively impacted and uplifted millions of Americans over years, right? It's good to see people of faith, different faiths working together. And also, making our prayers inform policy, having our prayers and our practices inform policy for the benefit of society. Because the alternatives are, working against us. We don't have to go into the deep recesses of white Christian nationalism in order to realize that it's antithetical to to lives thriving. When you're more concerned about what money is going into political resources that further, the interests of a few on the backs of the poor. That is real. That is a real thing. But I mean, there's a reason Jesus sent his disciples out 2 by 2. There's a reason that, there's a reason that the poor will always be with us. Why? Because Jesus knew our capitalistic nature. But if we do things, if we figure out a new way of doing things, which is evident in the work that we do as an interfaith community, good things happen, and they're still happening. And that's one of the reasons I keep coming back to work. Because I could have said a long time ago, hey, y'all can have this. I can move back to Texas and pick up preaching on a full-time basis. But at the same time, this is where I've been called to. This is all where we are now. And I'm grateful for the good things that are happening along the way to keep those. I'm glad God keeps giving us winks. We keep seeing glimpses of glory when we all work together. And that's why I do what I do in the interfaith space. And that's one of the things that keeps us motivated and keep going strong.
Well, my hope is that you get everything squared away there in D.C. Over the course of the next period of time, and then come back to Texas, where we still have some work to do. Christian, before I let you go and give you a chance for shameless plugs, I do, one of the things I do like asking people in these days that do seem dark sometimes is, where do you find hope?
Where do I find hope? In the smiles of my friends that I get to be on podcasts with.
Look at you.
In the smiles of the little kids that are so innocent, that are walking together in their school groups around DC. Seeing the fact that multicultural people can live together and talk amongst each other and not be in total conflict or in division. The fact that the sun keeps on rising. That's what gives me, seeing my elders at church, with a smile on their face, even though they've been through this before. That gives me hope.
Love all of that. Minister Christian Watkins, always have such a fun time talking to you. I want to give you a chance to leave us with any shameless plugs you have for us today.
Well, like I said, check out Network Lobby, Network, Network, Lobby, LOBBY.org, for the latest information that we've shared. Check out National Council of Churches.org. That's another organization. Check out Interfaith Alliance.org. These are all organizations here in DC that are putting out good information, regardless of tradition, but especially because of the tradition. And just get informed and get engaged. I look forward to seeing y'all on the battlefield.
We'll see you there. Christian, thanks so much for the time today. We'll look forward to talking again soon.
Yes, sir. Peace be with you.
All right, friends, it is always good catching up with Christian, and I hope you enjoyed that conversation as much as I did. I also hope that you're following along with Network Lobby and all of our other faith-based advocacy partners in DC. My hope is that the conversation and following those partners will inspire you to get involved. Friends, we have big advocacy asks and even bigger needs as we prepare for the upcoming election seasons. As always, Texas Impact has resources for you to do all of the things that we've talked about, so check out the website, our Substack, and all of the social media channels, including Texas Impact's Ledge TV playlist on our YouTube channel, which is a great resource to help you share the story of what's happening. Spend some time on the Action Center page at texasimpact.org to find out how you can get involved, sign up for a team, join the Texas Faith Votes campaign, and then invite all of your friends to join you. While you're on the website, I hope you'll take a moment to sign up to be a member of Texas Impact. Your membership supports this podcast and all of the work to engage Texans of faith to advocate for a more just and equitable Texas. It's a very effective and affordable way to put your values into action. So with that, I think it's time to close out this episode. So remember, the world needs Texans of faith active and engaged. So let's get to work.
Weekly Witness is hosted by Scott Atnet, engineered and produced by David Fasalo. Our executive producer is B. Moorhead. The opinions expressed on Weekly Witness are those of Texas Impact and our guests, and do not necessarily reflect the views of our sponsors. Weekly Witness is a product of Texas Impact, people of faith working for justice. Visit us online at texasimpact.org.